Shock is defined as a state in which there is decreased cardiac output or reduced effective circulatory blood volume. This impairs the tissue perfusion, leading to cellular hypoxia. So the end result is cellular hypoxia, and the cause is either reduced cardiac output، كمية الدم التي تضخ من القلب تكون قليلة، أو كمية الدم الإفكتيف الموجود في الجسم هي أصلا قليلة. هذا الحكي بيؤدي إلى نقص في تروية الأنسجة، بالتالي tissue hypoxia. Early on, shock can be reversible because cellular injury is reversible, but a prolonged shock eventually will lead to irreversible tissue injury and maybe death. From the definition, shock is either caused by decreased cardiac output or decreased effective circulatory blood volume, right? So it may complicate severe hemorrhage or extensive trauma or burn. For example, it may also complicate myocardial infarction, pulmonary embolism, and also microbial sepsis. So the causes of shock fall into three general categories. Each one show different cause, but it will result in decrease in the cardiac output. And we classify shock into three forms: cardiogenic shock, hypovolemic shock, and septic shock. The three will result in decreased cardiac output. Let's start with the cardiogenic shock. Cardiogenic shock results from the low cardiac output as a result of myocardial pump failure, failing of the pump. The heart cannot pump effectively adequate amount of the blood into the circulation. It may be caused by, for example, myocardial infarction or ventricular arrhythmia or extrinsic compression like in cases of cardiac tamponade, or even outflow obstruction when we have pulmonary embolism. All these causes will result in heart pump failure, and the heart pump failure means low cardiac output, and this will result in cardiogenic shock. Hypovolemic shock results from low cardiac output due to loss of the blood or the plasma volume. Usually, hypovolemic shock is caused by hemorrhage or fluid loss due to severe burn. The third form of shock is called septic shock. Septic shock is usually triggered by microbial infections. Certain types of microbial infections are associated with massive release of inflammatory mediators from the immune cells. These inflammatory mediators are strong and able to produce arterial vasodilation توسع في الأوعية الدموية vascular leakage and venous blood pooling فبصير الدم متجمع في الفينز. These abnormalities may result in tissue hypoperfusion and hypoxia لأنه في عنا massive vasodilation and we have also accumulation of the blood within the venous circulation مش عم برجع للقلب حتى يصير له oxygenation حتى ينضخ لللنج ويصير له oxygenation ويرجع back للتشو. This will lead to organ dysfunction and sometimes if this is severe and persistent may result in organ failure and death. This table summarizes the three main forms of shock. And as you may recall from the definition of shock, it's either caused by decreased cardiac output or decreased effective circulatory blood volume or both. So, in cardiogenic shock, the cause of the decreased cardiac output is the failure of the myocardial pump. And this can happen due to different etiologies. Failure of the myocardial pump may result from intrinsic myocardial damage. عضلة القلب نفسها فيها pathology. Like in cases of myocardial infarction, الجلطة القلبية. Ventricular rupture, like the heart ventricle got ruptured. Arrhythmia, عدم انتظام نبضات القلب. But in certain cases, the myocardial muscle is okay. However, there is an extrinsic pressure limiting the myocardial muscle contractile ability. يعني في عنا ضغط خارجي نتيجة تراكم سوائل أو دم في الغشاء المحيط في القلب, the pericardium. This is what happens in cardiac tamponade, where we have accumulation of a fluid or blood in the tissues surrounding the heart, limiting the heart movement. Or maybe obstruction of the outflow, because there is a pulmonary embolism that will obstruct the outflow of the blood from the heart into the lungs. This will result in decreased cardiac output, tissue hypoperfusion, and hypoxia. The second form of shock is called hypovolemia, and from the name you have decreased or inadequate blood or plasma volumes. The most common examples include hemorrhage or fluid loss. Fluid loss may happen in cases of like persistent vomiting, diarrhea, مرضى الحروق البرنز ومرضى التروما. The third form of shock results from certain types of microbial infections that are able of stimulating the immune cells to release large number of inflammatory mediators that will result in a peripheral vasodilation and pooling of the blood in the veins. So the volume of the blood will be decreased, the effective volume of the blood will be decreased, and this will result in decreased cardiac output, resulting in tissue hypoperfusion